Welcome back to Questions from the Waiting Room. As a recap, these are questions that people are too nervous to ask their psychiatrist. So I'm here with Dr. Nicholas Pejic, and my name is Emily Harper, social media coordinator.
Hello, how are you?
I'm going to go ahead and get to it.
Okay.
Nathan M. from Springfield, Massachusetts wants to know, what is Kratom? He sees it sold in gas stations, but here it's addictive. So how is it being sold?
Yeah, so Kratom is kind of a controversial substance because it can do some harm, but it's still legal in many places. Kratom, it acts kind of like a stimulant, and it's kind of like an opiate as well. So it's stimulating. Folks can feel like it's like caffeine where they can focus better on it, but it also can kind of be calming like an opiate might. And it technically works on opioid receptors, but it does it in a milder way. Milder in that it stayed legal, right? And so other opiates would be like Percocet or oxycodone. Those are known as like pain medications for like more severe pain. And Kratom happens to work similarly to something called buprenorphine. Buprenorphine is used as a treatment, which I prescribe for folks with like opiate use disorders, folks who may have trouble with using heroin, or they get addicted to pain medication and they don't want to take those anymore, but they can't stop because they'll go into withdrawal. That's when they stop the medication and they have like diarrhea, sweating, goose flesh, high intense anxiety, insomnia, and it's just terrible to watch somebody in opiate withdrawal. So what we do is we'll use buprenorphine in an FDA fashion to stop those symptoms. But that has to be very well controlled, and a physician needs to prescribe it and know what they're doing. They have to educate their patient about the medication. It's a very useful medication. Where Kratom is controversial in my mind is that it can push in those opioid receptors, and folks who use it, who are susceptible to addiction, might start to use higher and higher amounts of it, or they might casually start using, and they feel like, well, this makes me feel something, and they don't know that it's an opiate and that they can get addicted to it because there's no real warning for it on the labels, I don't think. And if there are warning on the labels, I don't think it's super clear. And so they'll take more and more and more, and sometimes they'll take like an extract version of it and get addicted to that. And addicted meaning like they need more of it to feel good, and if they stop it, they'll have withdrawal, and it kind of catches them by surprise. And it's kind of one of those things out there that to really master psychiatry, we have to be asking about all these substances, because I can't diagnose somebody with anxiety if it's like a Kratom use problem. So that's kind of where what Kratom does and how it can be troublesome to people.
Okay, this is another kind of difficult one. Charlie H. from Columbus, Georgia. I have schizophrenia, but don't want to take my medication. What other methods can I help control my mood?
Well, schizophrenia is less of a mood disorder than it is a thought disorder. Thought disorder meaning like patients start to think like people are out to get them, or they're being surveilled in a paranoid way, or thought disorder in that they can hear voices speaking to them that other people can't hear. And think of that for a second. That's a troubling symptom where you hear chatter, people either yelling at you or just commenting about what your behavior is, like what you're doing day to day. And you look around and nobody else is there, and you might start to respond to that voice, meaning you start talking to it. And so treating that is difficult without medication. Now, medications are very good often for treating what we call positive symptoms. This means that it's not a positive in that it's a good symptom. It means that it's a symptom of a brain function, let's say hearing and thinking, and it's amplified, therefore positive. And when it's amplified, like your hearing is amplified, it's not just you hear a higher volume, you start to get signaling into your brain that your brain ought to block. So the medications put the blocks back up and prevent somebody from hearing these voices talking to them, and kind of establishes more control. The other side of the coin of schizophrenia are what we call negative symptoms. And negative symptoms are kind of like feeling flat and have low interest in doing things, like as if one was depressed. But when it's within the context of schizophrenia, we call those negative symptoms because your normal functioning is just diminished. So a lot of folks, if you can treat the positive symptoms, they kind of clear up and they can think better, but then they don't have a lot of volition to go like do things, and it's quite hard for them. So we use other medications to try to perk up people's negative symptoms. So if someone has schizophrenia and they're hearing voices, they ought to go talk to somebody about that and see if what medications are available to them. A lot of those medications have side effects. So the physician and psychiatrist in this case has to be adept at knowing the meds and which ones cause which side effects. And medications are quite good at treating the positive symptoms. The negative symptoms, though, are harder to treat sometimes with medications. You can try different things out, like which I won't go to here, since this question is about not using meds. And the only other thing I can think of is like transcranial magnetic stimulation has been tried for negative symptoms, but the results are iffy. And then other than that is doing some kind of supportive therapy or reality testing where you're talking to groups, like a group therapy setting where somebody's helping you stay on track to care for yourself, and to know that some of these things in your mind are not actually happening, and to be able to not go down the rabbit hole and to entertain the auditory hallucinations. Like I'll tell my patients, listen, if you hear something chatting at you, remember this is a disorder called schizophrenia. That's one of the symptoms. The more you engage with the voice, sometimes folks, it'll bring on more voices versus if they kind of ignore them and just keep on task, if you will. And other than that, I'm because I mainly treat patients with medications, I don't have a whole host of things outside of medications to recommend to folks with schizophrenia myself, just because it's not what I do every day.
Okay, got it. Well, Haley M. from Little Rock, Arkansas has a cute little question for you.
Okay.
She just wants to know what book you're reading right now.
Oh, what book I'm reading right now? I got a few. I'm reading a book called Ego. I forget the guy's name who wrote it. But it's a book about stoicism. I think it's called Ego is the Enemy. And it talks about dealing with failure and how failure is a natural ingredient of success, and working on one's inner game to where if you're failing at something, how do you overcome that? How do you incorporate that into your mind being a necessary thing in life? And it's all based in stoicism.
Okay.
Yeah.
I might add that to my Amazon cart.
There you go. It's a good one.
Pretty interesting.
Yeah, it's a good read.
All right. Well, thank you. That's it. And
Okay, great.
Nice rest of your day.